We've certainly seen countless headlines involving a celebrity personalities battling addiction, and those are very public displays, and they may have somewhat tainted our view of addiction treatment and recovery. In fact, most people believe that being treated involves a long-term stay at a hospital or going away for long periods of time. Ed O'Reilly with the Neil Kennedy Recovery Clinic in Dublin is here to sort of give us a reality check. Welcome back, Ed. Nice to have you here.
Nice to be here, Gail.
Before we talk about the treatment part of detoxing, that's the first step, is detox. What is that difference between what you call the detox process and then the treatment?
Well, the detox is really a physiological issue. If your body is heavily dependent on particular drugs, you may need some medical assistance in getting off them. Okay. Some drugs, like alcohol actually, which a lot of people don't think of as a drug, can be dangerous to quit drinking abruptly.
Really?
If you've been drinking a lot.
Okay.
People can have seizures. So it can be impressive sometimes, and so you don't want to take any chances. Depending on the drug, there are other drugs that don't have as much in the way of withdrawal. A lot of people think, for example, marijuana has no withdrawal. It does. But it's far more subtle. It won't hurt you. It's a little bit like stopping cigarettes. People get crabby, restless. They can't sleep very well. Yes. Mm-hmm. Now, obviously, you don't need to be in a hospital for that.
For that one, but some of the others.
And some of the other ones can be dangerous. Opiate withdrawal, like painkillers and heroin, is not medically dangerous. It will not kill. Uncomplicated opiate withdrawal will not kill you. It makes you swear you're dying. Okay. And
so you can help someone navigate that process.
Exactly. And so there are some certain withdrawal situations in which people need to be in the hospital. Typically, however, that's 4, 5, 6 days most times is that phase.
And then we move to the treatment phase, which you've told me doesn't have to be hospital. Really, we have seen, I think, for years, people think you've got to go away to get sober. You've got to go away to get rid of the drugs in you.
Yes, that is, I mean, that did actually used to be the model, which is send people away for the cure is what I call it, okay, and get them back. I think the model we were thinking about that is you have an operation, you have a bad appendix, you have the operation, the appendix is taken out, you're okay then. And unfortunately, addiction is a chronic and progressive disease. Like all chronic and progressive diseases, the earlier you catch it, the easier it is to treat, the less expensive it is to treat, and the more successful the treatment is. Okay? So what that means then is, if you catch the addictive process a little bit earlier, right, before you lose the job, before you're living on the street, okay, very oftentimes outpatient treatment will actually do the job very nicely. So you don't have to go away for the cure. You can possibly keep working or keep going to school. And do, just for example, we offer an intensive outpatient program both for adults and for adolescents, in which the adolescents could still be in school, adults could still be working.
And it's just as effective, Ed.
It is, and actually in some cases it's more effective, because the problem is when you use the go away for the cure model, okay, you go away for say a month, 2 months, you're in a artificially protected environment.
True.
Okay, and some of them are very nice.
So, you don't want to go home.
That's right. It's like, for example, Eric Clapton started a treatment program in Antigua. You know, so it's like, okay, so you eat, sleep, breathe, recovery. You get nice and centered and well balanced. But what you don't learn is real world recovery skills. So you get out of this nice environment. You come back home. Okay, your old buddies are calling you on your phone. Okay, if you're a teenager, you have to go back to school. Okay? I mean, there are real-world pressures and real-world stressors that you didn't really have that much of an opportunity to practice dealing with inpatient. So even if you do a good inpatient program, and there are plenty, when you get out, you need to follow up with a good intensive outpatient program to help you learn the skills you need to learn in the real world.
Wow, Ed, that's really interesting. It's interesting how some of the thought processes have changed. If people haven't thought about it, maybe they'll think about it now, you know?
Yes.
But they don't have to take put their life on hold, basically.
Correct, yeah.
Ed, thank you. Nice to have you here.
Thank you, Gail.